an emeritus professor of clinical neuropsychology, and I've worked as an academic clinician for 30 years in the field of epilepsy. And I worked at a very specialist hospital in the UK called the Walton Centre for Neurology and Neurosurgery. And we had a very significant clinical and academic department that focused on specifically on epilepsy. So I've been practicing clinically in the field and also working academically in the field. And that's what I did for about 30 years. And then I retired from the university and I retired from the hospital, and I took up the post of Secretary General of the International Bureau for Epilepsy, which is a NGO that supports epilepsy charities around the world that focus on improving the quality of life of people with a lived-in condition. In terms of this particular area that we're going to talk about, I led the UK investigation on understanding the impact of anti-epileptic drugs on the developing utero. So my specific research was to look at anti-epileptic drugs and try to understand how they affect the brain development of the baby. And so we looked at 600 live births and we followed those children up for 6 years, serially testing how their brains were working. And since that time, and since we published those results, I've been working on projects that try to make sure that people with lived-in experience who are thinking about having a baby or not understand the potential risks associated with that from the perspective of the anti-epileptic medication they're taking. This piece of work that we're going to be talking about arises originally from some observations that were made in our clinic back in 1990, when we noticed that children who were specifically taking sodium valproate, whose mothers were taking sodium valproate at the time of their pregnancy, were more likely to have learning difficulties than those children who were exposed to other anti-epileptic drugs. And it was just one of these incidental findings. And so our team decided that this was worthy of looking at more in depth. And so we conducted a series of studies to actually try and see whether our hypothesis had any real depth and breadth. And we did a couple of studies where we were able very clearly to identify that those children exposed to sodium valproate during their mother's pregnancy, which were more likely to have learning difficulties than those children who weren't exposed, or not children whose mothers didn't have epilepsy at all. And our group published about 25 papers in medical journals on the findings of our research that lasted about 15 years. And of course, as a neuropsychologist, I'm interested in trying to make sure that people with conditions like epilepsy really try to understand their condition and understand the consequence of their condition. And I think that the more you know about your illness, the more likely you're able to cope with it, the more likely you're able to make good decisions about the treatment that you receive, and an awareness about the treatment that should be provided as well. So this is a particular study that was funded by UCP, and they were interested in trying to identify exactly what women understood about the risks associated with having a child. The study was to provide insight into the experiences of women with epilepsy. We wanted to do this in a way that was fairly unique. And the uniqueness was the way we actually, the methodology we used to actually conduct this study, which was to look at social media listening. And so we took social media from 6 different countries over a period of, I think it was from January 2020 to January 2021. And we covered them over 6 countries, and that gave us 246,000 posts. And we just identified a number of themes that came out from that social listening. And those themes perhaps weren't particularly surprising certainly to some of us who have done research in the area, but might have been of interest to people who were managing people with epilepsy and wanted to know and understand about what women with epilepsy and their partners and their families understood about the risks. And so we identified a number of themes. And if I could just draw them to your attention, one was the uncertainty and fear arising from changing treatments. Well, two was worries about the inconsistent communication from healthcare professionals and lack of information on anti-seizure medication. And three was providing a safe environment for fetus and infants became paramount, including the balance between achieving seizure control and taking anti-epileptic medication. So there were a number of consistent themes that came out of this survey. And this survey was important because it continued to identify that there is a lot of women who are very anxious about taking anti-seizure medication, particularly if they're thinking about having a family. But it also supported the results of other research that have been done by other groups, including my own, which identified that people just do not have enough clear understanding about the risks associated with having a child while taking anti-seizure medication. This survey is important because it just keeps on reinforcing those important messages that we owe a duty of care to make sure that people with epilepsy understand the risks associated with their condition so that they can minimize those risks. Well, I think the first of all is to understand that there is a significant number of women with epilepsy who are concerned that they don't understand enough about the risks associated with their anti-seizure medication and its effects on any unborn child. That's the first thing, is to recognize that this is a problem. The secondly, to think about how they address that problem. What sort of information and advice do they need to provide their patients, people with the lived-in condition, about the risks? And how do you deliver those risks in a way that actually allows somebody to understand without increasing their anxieties? And so the IBE, the International Bureau of Epilepsy, of which I'm the Secretary General, we're very cognizant of the need to provide clear information about those risks. And on our site, we have information that has been translated into 12 different languages about all aspects of having children or not having children and the risks associated with that, including anti-seizure medication. And we would like health professionals to be able to access clear information that can be passed on to any woman of childbearing age who wants to think about having a family. Because actually, you have several approaches you could probably use. You can just do some interviews of randomly selected women with epilepsy. That's going to give you a small number of respondents to deal with. But the generalization of that when it's a small study is problematic. Or you can do surveys. And surveys are quite significantly labor intensive. They have to be completed, they have to be returned, they have to be analyzed. In this way, we managed to get access to a substantial wealth of data that was actually as a result of women talking to other women about their concerns about having a baby while they're on anti-seizure medication. And that gives you a whole different wealth of information that you can look at. It gives you a large, sizable number of things to look at. It helps you identify themes, and it is very much validated by the actual communications from women themselves, rather than me as an expert saying, well, here's 10 questions I want to ask, we want you to ask in relation to helping us understand about what you know, as opposed to looking at a wealth of data that actually comes from women about women with epilepsy about their concerns. And I think that's a unique and very interesting way of collecting data. Obviously, I'm very grateful to UCB for providing the resources to conduct this study. That's really good. Secondly, that this study just validates all the work that's gone before it, in that there is still an essential piece of work to do to allow women with epilepsy to really understand the issues in relation to childbirth and pregnancy and the effects of anti-seizure medication. And in an ideal world, I would like people with epilepsy generally to have a really good understanding about their condition, because I think that's an essential contribution to their self-management. And self-management is important when you've got a condition like epilepsy.